Kriya practice, the cleansing practice. Basically, we do it in the part of the yogic practice, do physical cleansing, also part of the mental cleansing also. So, if you attended the theory class, you already learned about the Shatkriyas, the 6 Kriyas. And one we are already practicing in our yoga classes, that is Kapalabhati, cleansing your respiratory system. Okay. Today we are basically focusing on the cleansing of your nasal passages. Okay, that's called Neti. Other techniques normally it is taught during your teacher's training course, so we are not demonstrating now. So we'll give you some basic idea of what is the purpose. Okay, so normally our nasal passages get blocked sometimes, or there is a lot of pollution. Sometimes some like bacteria accumulate there. Okay, so we cleanse that passage using salt water and also a catheter. Okay, in the older time they used cotton thread with wax or ghee on it. Recently it's easy, catheter is there, so you can. It's not very heavy also, very thin. So the nasal cleaning purpose basically is to cleanse the system. Also it stimulates your nasal, the mucus glands. Okay, then after that you will get a feeling of lightness and wellness. Okay, and also this is done basically before the pranayama practice. So if you do it regularly, it will benefit you. And also some contraindications are there. If you have infection, okay, severe infection, you should avoid. Sometimes it may aggravate. Otherwise, everybody can do it. It's not difficult, especially this one. This one is a little bit challenging. Okay, so but you can give it a try. Correct.
Easy.
Huh?
Easy.
Yeah, easy. Easy for him. But once you learn the technique, okay, just like learning yoga asana, initially you thought it is quite difficult, all those postures. Now you can do most of the postures. Similarly, you can practice also. Gradually, then you will be fine. Okay, so you can make it as a lifetime practice. So that especially if you live in a very polluted city, this is a very good practice. Especially this one. It cleanses your system and the dust and everything particles goes out. Okay, and then you feel wellness after that. So how it is done? You fill the pot with lukewarm water. Okay, not very hot or not very cold. It is somewhat like our body temperature, same temperature. Then you put a pinch of salt in it, a pinch of salt, not too much or too less, a pinch of salt. So it is somewhat like our, the tears. Okay. If you're not sure, you can just check when you're trying. Okay, so that will be the same taste. Okay, same like your tears. So how to do it? You stand tall. Okay, then you slightly take your head forward. Slightly, you don't have to do too much. Then you fill your mouth open. Otherwise, the water will go to your lungs. Okay, so you breathe through the mouth and just very gently, just put it there. Till water will come out. Okay, you don't have to do any pressure or anything. Just breathe through the mouth. It will flow freely. Okay, so. So normally you can use 2 pots, one for left and one for right. So if the temperature is right and if there is a little bit salt, then you won't feel any discomfort. Some people do it with normal water also, but it depends. Okay, then you can feel that water is there. Sometimes it stays in your mucus area. So what you have to do is just breathe out forcefully, or you can do few rounds of Kapalabhati. Okay, until all the water is gone. Or of course we will be practicing Kapalabhati. You can feel Shirshasana, you can feel that water slowly coming out. But ideally you remove all the water, okay, before start. So that's here. Next one is very easy one. Okay, that is inserting a catheter through one nostril and taking it through the throat. Okay, so and remember the passage is like this, not like this. Okay, So you have to very slowly do it. And ideally you wash the catheter before that with the salt water. And we find it very difficult, you can put some ghee, okay? All right, now it comes through the throat with the 2 fingers, you just pull the thread out, okay? All right, then you just put the thread together and slowly brush it, okay? So all the mucus in your system, gets accumulated on this one, and you take it out. Well, for him it is very easy. So while you're learning anything, you find is very challenging, but it is not so complicated. Okay, so that is very careful. You need to keep holding while you insert it. Just very gently and very slowly insert, and you can feel the the thread coming, touching your throat. Then very gently. Of course, initially you will have that vomiting feeling and everything when you put the, but gradually, if you manage slowly, you can just do this. Okay. All right. So, any questions? No questions? So then you are ready to practice? Did I miss anything to tell?
How many times
daily? This is okay, but Sutra maybe you can do it once in a week or something. So, no problem. Yeah. But this practice is good, especially if you are staying in a polluted area. So it's really cleanses, and you can feel a lightness after that.
only one time, each side. You want to try this? You want to keep it with you? Somebody is asking. It is both nostrils. Both nostrils. Fine.